Gramagat, Ceann Corla Boilum Corfalcha Riv na Hatruha on Shachtan Shakacha o Heave or Dihe Alternish agus na Hibraka own agus Crejim da Miechan Ramis Shaw a Gwyn o Hús Govetvi a Lors a Lawn Sailta a Hawaii. And all our sympathy and solidarity goes to those who've lost lives, who are ill at the moment and who are currently facing consequences of that and all their families. I do have a question to ask on the death rate in nursing homes. I understand the latest figure is 450. Not all of them are laboratory confirmed, but most of them are. And I want to ask you, do you find the figure, out of that 450, 9 were sent to acute hospital settings? Do you find that incompatible? And would you be able in the future, do you believe, to stand over every single case where a decision was taken not to send somebody into an acute hospital setting? I understand there are a lot of complications that this can set on very quickly, but 9 out of 450 seems to me not a compatible figure. So I would like to ask you, in that case, will you be checking on every single one of them that the right decisions were made in the right setting with the right advice? I want to go on, therefore, to talk about the next catastrophe which I think we're facing. The direct provision centres are our next possible catastrophe. And Peter Tyndall, the Ombudsman, said yesterday in report, and I quote, "The highly contagious nature of the virus brings into sharp relief just how unsuitable and unsustainable it is to have 3 or more people in the same room." And that's the provision we are told is being made for those who live in the direct provision system. It's an issue of immediate concern, Minister, and I think we need to ensure that everything is put in the direction of trying to avoid a situation that this becomes the next serious cluster. We do have healthcare workers living in direct provision, and we were told that they would be put into separate accommodation. My next question to you is on the protection of other workers. We now have bus workers driving up and down the country without being protected because there are no screens on Bus Éireann's fleet. They have asked for free public transport, their unions have asked for it in order to stop any interaction with passengers. They haven't been given that. We are told that the HSA has no role to play in the health and protection during this public pandemic crisis. We are told by Heather Humphreys that they are looking into the HSE playing a role insofar as environmental health and safety officers will be, their role will be expanded to check out workplaces. Can you elaborate on that to tell us that building workers, bus workers and others who resume work will be protected in their workplace with the protocols that are necessary, PPEs if necessary, screening and indeed social distancing? And my last question to you is on the question of private hospital deal, because you said, and the Taoiseach has said, nobody should profit from this crisis. It beggars belief that at nearly €1,500 a night per bed unoccupied, that there isn't vast profits being made by some of the wealthiest people in this country who have the major shares in the big private hospital chains. Please explain that anomaly. And finally, I'd like to ask you the question of masking and how you feel about encouraging, not forcing, but encouraging the public to mask up.
Ceann Corla, about 20 years ago, 80% of nursing homes in this state were publicly owned, 20% private. Today, there's been a complete reversal, 80% private, 20% public. That's the result of 20 years of government policy incentivising the development of the private nursing home sector. Won't go into that now. But what this means is that the majority of nursing home workers do not have access to the HSE's occupational sick pay scheme. It means that the majority of nursing home workers do not have access to an equivalent sick pay scheme. In fact, I'd venture a strong guess that the majority of nursing home workers do not have access to any sick pay scheme. It means that if they get sick or they feel the need to self-isolate, their maximum income is likely to be €350 in a week, which is a big cut on their weekly wage. In some cases, it would be a cut in half on their weekly wage. This is wrong. This is very, very wrong. And I'll give you 2 reasons why it's wrong. First of all, while I'm sure the majority of nursing home staff, if they woke up in the morning and didn't feel 100%, would take the financial hit and self-isolate, it means that there is an economic pressure on those workers to go to work and to take a chance. We talk about absenteeism. There's an opposite, presenteeism, and that is a push factor for presenteeism, which is a danger to health, safety and to lives. It's also very wrong that if that worker does get COVID-19, for argument's sake, and they're off work, a frontline worker is taking a cut in their pay, possibly of half in their pay rates. Now, SIP2's Paul Bell said the other day that the private nursing home sector should be taken into public ownership for the duration of the crisis. I believe it should be taken into public ownership, full stop. But what I'm asking you here is this. This is my question. Are you in favour of saying that for the duration of this crisis at least, that those nursing home workers who do not have access to the HSE's occupational sick pay scheme in the interest of health, in the interest of safety, in the interest of lives, should be given access to it straight away? If you could answer that question, I would appreciate it.
Deputy Smith and Deputy Barry for the questions. In relation to Deputy Smith's question, and in fairness, she acknowledged that it is complex when it comes to anybody in long-term residential care, because there can be a number of factors, quite apart from COVID-19, where an individual can decide whether they wish to leave their home, which obviously is what a nursing home is, their home, to seek hospital treatment. And that's generally done on the advice of a doctor, other clinicians, often in consultation with your family, and of course the wishes of the individual. There can also be a case where people have made it clear what they would wish to happen to them in terms of what treatments they may wish to get if they do get sick. But I want to assure the Deputy that these are clinical decisions. So no, they're not my decision as Minister, and you're not suggesting they are, or yours or the Oireachtas'. They are individual clinical decisions, just like you'd expect or I'd expect a decision about my health or welfare to be made by me in consultation with my doctor and not by the Oireachtas or the Minister. So the clinical guidelines that are in place for COVID-19 are the same for all of us. Whoever we are, whatever age we are, wherever we live, there's one clinical guideline governing COVID-19. But of course there are other factors when it comes to living in a nursing home, including some of those that I've outlined. But I would point out that there are obviously many protections in place for anybody who's concerned about any outcome or conduct of a healthcare professional. Not that I'm suggesting that issue arises, and obviously HIC would do regulate the issue as well. So I am satisfied with the guidelines in place. I'm satisfied from talking to the Irish College of General Practitioners with the approach being taken by our GPs as well. In relation to direct provision, and in fairness, you highlight this issue regularly. I know a lot of work has been undertaken by the Department of Justice to make sure, and I've seen a statement from them, I think as recently as today, in relation to making sure that there is accommodation available to isolate for somebody who has a case of COVID-19, or indeed could be a suspect case as well. In relation to the healthcare workers and that specific question, we now have 278 people who work in the Irish Health Service taking up our offer of accommodation. Now, I obviously don't know whether they're from, I don't know the backgrounds of all of those people, but I know the 278 people so far have taken up our offer of alternative accommodation, and that's absolutely available to anybody working in the health service, be they in direct provision or not, and there's good details on how to apply for that on the HSE's website. In relation to the issue of bus drivers, or indeed, as you say, anybody working in relation to any part of our economy or any part of society, even in environments where it's not necessarily possible to fully physically distance, there have to be measures put in place to safeguard people, including guidance on PPE where necessary as well. I'm thinking of places like factories and construction sites as well. So I want to be clear to you that NEFIT, the National Public Health Emergency Team, will be monitoring this very, very closely as we move towards any decision to reopen any part. And on the issue of the bus drivers, I'll specifically talk to the National Transport Authority through my department and revert to you directly. On the issue of private hospitals, look, I think I'm going to run out of time in this regard, but let me be clear. The idea here is that nobody should. Well, I'm happy to stay here and talk as long as you want, Deputy Barry, but I am confined by the clock. So in relation to the issue of private hospitals, which I published the deal here, laid it before the Oireachtas last week for all to see. But the issue is nobody should make a profit. We will be paying the cost of running the facility, and it will be subject to scrutiny by the Controller and Auditor General. I'm quite sure, and it would be entirely appropriate and necessary and essential, that the PAC will scrutinise this as well. But bear in mind the conversation we would have been having if we hadn't secured this. you'd be asking me, where are the ICU beds, where are the ventilators, where are the isolation facilities? It's some achievement for the HSE and the Department of Health to have secured the use of 19 hospitals for the duration of this crisis. And what I want to see now is making sure that we're using those assets and that we're protecting the surge, because, by the way, the surge might come. I heard somebody say, will you rip up the agreement? I mean, geez, it'd be an awful brave politician to say, will you rip up the agreement, give back the ICU beds and give back the ventilators? You'd be an awful lot more certain about the path of this virus than I'd be. So we're ripping up no agreement, and we're keeping the assets that we have, but we're going to make them, and I have seen deputies in this House, Deputy O'Reilly suggested, we're going to make sure that they are busy. On the issue of masks, the National Public Health Emergency Team will guide my view and inform my view in relation to this. You know, they made a change already in relation to healthcare professionals, healthcare workers, and they'll be looking at the issue of the broader public as we ease restrictions. On the issue of the sick pay scheme and the likes, Deputy Barry, I don't have any plans to extend that scheme to people working outside of the health service, but I'll correspond with you further on it.
To suggest that I suggested that the agreement be ripped up. I did no such thing. I think you may have misspoken, Minister, but that's certainly what it sounded like to me. But I did no such thing.
You did absolutely no such thing. I happened to catch your eye at the time, but the deputies in this House did in recent days contact me via a variety of forums and suggest we should rip up the agreement to give back the private hospitals, and I have no intention of doing that.